you're looking at the population in Texas, the Hispanic population by far is the largest uninsured, by far. And then other ethnic minority groups are part of it too, but Hispanics are the number one. In the U.S., Hispanics are the number one uninsured. We're the fastest growing segment of the population, but we're the most uninsured. And there's a lot of reasons for that. You know, one, the types of jobs that we work in. Before the ACA, you know, it was hard for people to get insurance, and I know that's working insurance. People would, you know, if you worked, many Hispanics were working multiple part-time jobs, and not a single one of them provided them insurance.
Yeah.
So, you know, it wasn't uncommon that I would see somebody working 60, 70, even 80 hours in a week, maybe 3 or 4 different jobs, but didn't have insurance because their employers kept them under the line as far as how many hours you had to have in order to qualify for insurance, right?
Yeah.
So because of that, many people were uninsured. And so they worked pieces of, you know, I worked 20 hours here, I worked 15 there, I worked, you know, whatever here, 30 here, whatever it was. But it was never enough by one employer to have the insurance because there were requirements for them to be, you know, working there for so many hours in order to have it. Some other factors, obviously there's a big factor, and you should research this, there's a lot out there, is health literacy. And not just literacy, not just health literacy in general, but also literacy about health insurance. Knowledge, but really working and user knowledge. You know, how does it work? What do we do? How do you do? What is it for? How does it? Think of this. Many Hispanics in the United States, from their countries of origin, are not familiar with employer-sponsored health insurance, right? If you think about it, before the ACA, what were the ways people got insurance, health insurance? Think about it. How did we get it? You were employed, and you got it from your employer if the employer offered it, right? You bought it yourself, or you got on a government program like Medicaid, Medicare, dual eligible programs, S-CHIP, depending on what group you fell into. Those were the major ways of getting insurance. Well, if you came from a country in Latin America, that's not the norm. It's not so much employer-driven as it is in the United States. So if you come from a country, let's just say, Mexico, for example, or Argentina, Panama, Ecuador, you name it, Peru, wherever, right?
Yeah.
The model of health insurance is not the same there. It's more of a public health model there where the government is providing it. It's more of a socialized medicine approach. In fact, Mexico is one of the largest public health programs in all of Latin America, and one of the oldest. So if you come from a place like that, and then you come to the United States, there's even for African Americans, my colleagues ran the African American division of the program that we were involved with. It wasn't language, but it definitely was cultural identity for African Americans too. So imagine this. So I can show you these things. I don't put any culture or none of that in it. How likely are you to pick that up again and read it? Less likely. But if I can approach your culture and your language and your identity when it comes to your health, something that's very personal,
you get a positive
you're more
response.
likely to do it. You're more likely to engage. That's kind of like common sense, right?
Mm-hmm.
Because I'm appealing to you. So we found out ways that Hispanics like to consume health and like to learn about their health. One approach that was pretty common among, regardless of the type of Hispanic, is have everything bilingual. Have everything you give me, even if I'm an English-speaking Hispanic, bilingual. And I'll show you how this appeals to literacy. If I give you things that appeal to you, you're more likely to want to learn about it or read about it. Okay?
Yeah.
So if Hispanics in focus group studies told us that speaking Spanish or English or designing programs in both languages was appealing to them because it appealed to, and I'm going to use a word that you may not have heard before, their Hispanicity, right? Their identity as a Hispanic, and it was more appealing. Guess what? They were more likely to use that material or read it or try to ascertain something from it.